Welcome to another episode of Chill with Bill. We are at Natural Bridge Caverns, and actually at the spot where the discoverers, the cave explorers, came out into what's called Pluto's Anteroom back in 1960. And I want to welcome Dr. Kidd to the show today. Dr. Kidd is a pediatric general surgeon. Tell me a little bit about that. How in the world did you choose that path in life?
Well, it's fascinating pathology. We get to do anything between the chin and the toes that's not a heart or a bone. So you get to use everything that you learned in med school.
Like a spelunker. I kind of look at a general surgeon, particular pediatric general surgeon, kind of like a spelunker exploring. Does that analogy make sense to you?
It does. There's always, every 2 or 3 months, there's something completely new that you've never seen before, which is the other fascinating aspect of it. We're always getting to invent ways to do things.
I understand that there's some new technology that's out there for kids at North Central Baptist. Can you tell me a little about that?
Pediatric surgery historically have been slow to adapt to new technology. So for us, it's relatively new, fairly mainstream in the adult world. We're trying to use it more and more because over time, just like laparoscopy, things will get smaller. 20 years ago, laparoscopic surgery in kids was controversial. Now it's mainstream. I'm hopeful that if we get in on the front end, in 20 years, robotic surgery will be about the same place.
And why is that? What's the advantage of robotic surgery over a typical laparoscopy?
The visualization is amazing. The optics we see so much better. The control of the instruments is so much finer. You can do things in a way that does not cause as much trauma to the tissues that you're working on. At the end of the day, it's much gentler. It's still a growth process, however. We're still trying to find applications, but we'll get there.
To me, it sounds like robotic surgery is a lot like the cave explorers. There's so much delicate formations in the cave. You see all the cave drapery and the soda straws, stalactites and stalagmites. It just kind of reminds me of the same thing. You need to see where you're going and know what you're touching.
See where you're going, safety first, obey your first principles. I'm sure the first cavers thought of the same things that the new cavers do, but the new cavers have better tools. And as the tools get better, we can do more.
Dr. Kidd, what type of conditions do you see and treat every day?
Commonplace things, hernias, appendicitis, more and more gallbladders. In the neonatal world, mostly hernias. Most people get into it for the babies, and the things that we are especially trained to treat: congenital malformations of the GI tract, of the chest wall, of the lungs, cancer.
At North Central Baptist, we have the level 4 NICU and maternal levels of care, the NEST. And I know sometimes, unfortunately, we deliver babies that are really small, either extremely low birth weight babies. Do you operate on those, and how do you learn to do that?
We do operate on those when necessary. Obviously, nobody wants that for their child, but if it's necessary, it's necessary. The smallest baby I've operated on is 390 grams. Grams. So about a little bit bigger than a Coke can. That child is actually doing well. They're 12 years old now. So yes, we operate on those kids, and learning to do it just like learning to do anything else. First principles. You be gentle, do no harm, and do your best. And over time to get better at it. There's nothing better than running across a parent or a child 15 years later at the mall, at a restaurant, and they're doing fine. It's really, really rewarding. You can't put a price on that.
Dr. Kidd, I know at Baptist Children's Hospital we have the brand new Da Vinci 5 robot. What in the world is that? What does it do?
It is the latest iteration of the robotic surgery platform. It enables haptic feedback, so the robot will sense the tension on the tissue and translate that to the surgeon's hand. So a little bit more feedback. The other robotic systems don't have that. And much like laparoscopy, there's a lot of learning how to push, when to push, how hard you can push. The Da Vinci 5 will be much more intuitive and much more like quote-unquote standard surgery. It's really, and just the software is just amazing. The things you can do. You have ultimate control over the camera, over the tension, over the instruments. It's really like learning to play the drums. It's a symphony of things that you can do we haven't even really cracked yet.
I know the cave explorers, had to use lighting to be able to get down here and navigate their way. Does the Da Vinci 5, does it come with special lighting that helps you navigate and treat patients?
Its camera enables 3D visualization and enables the surgeon to control the camera, the magnification as they're operating. Traditional laparoscopic surgery, you're relying on somebody else, another human who moves. With the Da Vinci, the surgeon has control, and there's no second guessing what there means or what that means. It's ultimately everything's in your hands. The optics are such that you can see things that you can barely see, even open with magnification. It's very enhanced. For instance, biliary disease. There's a special light that'll light up the common bile duct and the common hepatic ducts and the cystic duct to avoid injuries to the common duct. And it's a flick of the switch. And it can save common duct explorations. It can save major disasters. It's really most impressive.
Dr. Kidd, thank you for joining me at Natural Bridge Caverns right here at Discovery Crawlway, March 27th, 1960, when those original spelunkers came and got to see the rest of the cavern. We'll have to show up for other episodes that you'll have built out here at Natural Bridge Caverns to see the rest of the caverns. But I wanted to thank you for coming out today. It's been a real pleasure.